Good afternoon. Myself and my colleagues are here today to represent the Adult Community Division. I am Anne Harris, the Quality Assurance Lead for the Adult Community Division.
Good afternoon, I'm Victoria Slight. I'm the Mental Health Clinical Transformation Project Lead within the division.
Hi, good afternoon. This is Dr. Ramesh Shankar, Clinical Director of the Community Division, as well as Consultant Psychiatrist in General Psychiatry.
So today we'd like the opportunity to share with you some of the actions in the division in response to the COVID-19 pandemic, and these include our digital offer across services, the extended working hours of the CMHTs, the medical resource and leadership and support packages, and to finish with a summary of the Trust's transformation of community services. For the digital offer, work had already started prior to COVID-19 to ensure that we increased access to services by offering digital and remote working. However, the plan to introduce this slowly and roll it out over a 2 to 3 year period with steps to change in our early intervention service using VitraCare was escalated due to the COVID-19, which forced us to react quicker in terms of delivering a digital offer. The VitraCare is a digital platform that Steps to Change and the Early Intervention Service have worked with our commissioners and providers to develop bespoke platforms unique for their service and service users. Our Steps to Change service moved to a remote and digital working in days using WebEx and Q Health. However, the digital offer is not for everyone, I would like to say, and it is in addition to the normal working practices of our services. Within the CMHTs, we extended our service provision for the community mental health teams. So what we did, our community services rapidly extended their offer to a 7-day working in order to respond, offering early intervention across the 7 days to patients whose mental health state presented and indicated that they were at risk of immediate deterioration or relapse. This was quite unique, as nationally, talking to colleagues at the Royal College of Psychiatrists, most community services and CMHTs had actually reduced their offer.
Thank you, Anne. I will be talking about the medical resources and leadership. We all know that we are going through a real unprecedented situation in living memory. And from history, we know as a human race, we have gone through multiple pandemics, including the plague, where we lost nearly 75 to 200 million humans across the planet. And this invisible organism, the virus, has kept many of us inside, and the whole world has turned upside down due to this pandemic. And whenever human race goes through crisis situation and healthcare scares, we always look forward to healthcare workers on the front line to come to the fore and help out with the situation. And we always look forward to the experts in that field of healthcare. And as doctors, we are expected to engage and provide leadership. And I'm really fortunate to have a fantastic cohort of colleagues within our division who voluntarily put their hands up to support us. In terms of provision of outpatient clinics, we have continued to maintain the same level of care. We have not shortened our outpatient clinics. We did manage to continue to assess patients in the outpatients face-to-face as appropriate, but most of them are through digital virtual clinics. And most of the patients and service users and families, they are more than happy with the digital offer, but some did request for face-to-face, which we provided as appropriate. As these are unprecedented situations, we needed to have a safety net. Hence the reason, despite our normal MDT working, we have to enhance our discussions in the MDT to make sure that every patient had the best possible care package put in place. As we continued the normal outpatient clinics without reducing the number of patients, we had been more than efficient with the number of patients being seen in many localities, and hence there has been no increase in the waiting times of the outpatient clinics.
I'd just like to just go through the next couple of slides, and these are just some examples of some of the additional support packages that the teams have used to support service users again during this period. The Recovery College has continued to deliver courses online. We've provided self-help guides, coping skills toolboxes, coping skills bingo, anxiety management quizzes, and these are all additional resources to try and support service users to maintain their well-being during this period. The next slide again is an example of an initiative from the Skegness Community Mental Health team. These were a virtual craft group. So the staff and volunteer at Skegness team developed these craft boxes. They were delivered to service users' doorsteps, and then they were able to virtually still maintain a craft group. And Victoria, now to you. Thank you.
Thank you, Anne. So community mental health transformation has been talked about quite a lot, I think, over the last few months. And this afternoon, I'd really just like to get some key messages across to you around what that really means. So from an overview perspective, it's really about making sure that all the services in the community are joined together and they can support you then in the way that you need them to do so. And when we talk about services, what we mean is all the services that we offer here in LPFT, plus working with our colleagues out in the wider system. So thinking about charities, voluntary sector services, people that you will be very familiar with within the council, to ensure that we wrap that care right around you and make it easier for you and your family to access the support you need, and importantly, when you need it. And I think it's a really important point to think about that when somebody's in crisis or suffering with a serious mental illness, often their family are providing a huge amount of support as well. So transformation wants to ensure that everybody gets the support that they need. We've also listened to you, and we know that sometimes it can be difficult. We live in a large rural county to be able to access the services that you need. So we want to make sure that you're able to do that in the heart of your community and maybe be able to walk to the services rather than travel on a bus. But ensuring that all the time you're growing the network of people around you that will support you to keep you well. This slide is to try and help you understand how all of these things might work together. So there are 4 key elements on this slide in the red circles. The community hubs. These are hubs that we've developed together with you within the community and many other charities and voluntary sectors. People like the co-op are involved, your normal sort of everyday services, even down to local shops, so that you can work together and be able to access these community hubs and maybe even find a role that you can provide in there. On top of that, there'll be some crisis cafes across these sites within the county that you can access 24 hours a day, 7 days a week, 365 days a year. And at the moment, the crisis cafes are running overnight, so often providing services where traditionally it may have been more difficult to access them. At the heart of all of that is making sure that there's no wrong door. Never should you feel as people that you can't find the way into a service, and that actually you are the person that's in control of your care. So we want to make sure that by providing wellbeing for everybody, we support each other. So we're very heavily linking things to an agenda that's within our work around what matters to me. So listening to you so that you tell us what matters to you rather than we do to you. To help support us, as Anne mentioned earlier, we are using some digitalisation work. And the aim of that is, as Anne very rightly said, it's not to replace a service, it's to add to. So we are looking at things like VitraCare, we're looking at things like putting points into our community hubs, into our GP practices, into our libraries to help you to be able to access that technology. We're also making sure that all the way along this, we are working with you. So we are co-producing what we do. We want to listen and respond. We want to make that difference to you. And we genuinely want you to feel that you own this transformation. Importantly, we want to make sure that it lasts and that it's sustainable. So as we move through this, we're making sure that the funding and the way that we can develop these services is able to be owned by you as a community with our support. We've talked about how we will make sure that you can access those services, and again that is about walking in. There will be opportunities for you to walk in and there will be no wrong front door. We'll make sure that that no wrong front door is easy to access. So even if somebody's in crisis in the middle of the night, they will be able to access a crisis cafe, such as the Nightlight Cafe that's now running in Lincoln. And that can be through a telephone call to our helpline Mental Health Matters, or it could be through a digital connection, or it could be through a referral from maybe one of our social prescribers or one of our community teams, as we've talked about, who provide you that massive amount of support. But most importantly, and what I'd really like to finish on, is we want to listen and we want to work with you. So we need to make sure that you're able to tell us what we need to do and make sure that we're really delivering the services that matter to you. So we will welcome your feedback, and we would like to make sure that you have a voice so that you own your services. Thank you.
Okay, so that's the end of our presentation for this afternoon from the Adult Community Division. If anybody's got any questions, we're happy to answer. Please go ahead.